Good morning, everyone. Very nice to host you this morning. For those who woke up, I know it was for some a late night yesterday, and for everybody online. I'm Charlotte Marchandise. I'm the Executive Director of EUFA, the European Public Health Association, who gather public health associations all over WHO Europe, meaning 53 countries and not only the 27. I'm really happy to host this session, and thank you to Gastein Forum to have us. This session is the role of civil society organized in the context of your research, Eleanor, on better regulation for better health, hosted by the University of Edinburgh. It explored the way in which various elements of the EU better regulation agenda, stakeholder consultation, impact assessment, evaluation, shape the policies. Do we shape the policy as civil society? Do we change something? How do we shift the balance of power? Because so many times there's a great article in the journal you have in your bag about that, about your research, showing that many times industry, there are much more people from industries than the civil society. It's also how we organize ourselves. How do we work together? And yesterday we had a letter together with 27 organizations of the civil society in Brussels to ask for a meeting with the president to talk about the health in the new commission, which is going to be a big problem. It's a fight of David versus Goliath. We have to fight together. But we have to learn from each other. We have to build competency. We have to be better, because otherwise we cannot win this fight. We also all the time want to fight the good fight, but what are our base? We know it's evidence. How do we translate evidence better? But it's also not only a Brussels bubble thing. We have to work with member states. All of our civil society organizations have people in the countries. Do they know about EU regulation? Not always. Even now, from the people here, I don't know how many of you really know how the Commission, how the Council, how the Parliament are working. We also need, as civil society, to do this work on participation. This session will talk about the what and about your research, Eleanor, but we also said that we wanted to go to the so what and now what, because many things we also know. We know we don't want to repeat. We know we want to build competencies, to structure ourselves, to have more efficiency, to evaluate what is our work doing. Do we make better health for people, which is at the end our mission? So we really like to challenge our speakers and also the people in the audience and online to bring solutions that we can next year see what we have done with this session. What are the impact of this session and what we can do together. So here, I introduced you a little bit already. Eleanor Brooks, you're a senior lecturer in the European Health Policy at the University of Edinburgh in the UK, and you were the principal investigator of Better Regulation for Better Health project. We also have Stefan Schreck, your advisor for stakeholder relations in the European Commission, Directorate General for Health and Food Safety. That said DG Santé in your badge. Maybe sometimes people don't even know what it actually means. So DG Santé is Directorate General for Health and Food Safety. Anka Thomas, you're the Executive Director of the European Patients Forum, and Raymond Gemen, you're Head of Policy at the European Public Health Alliance, and your association participated in your research. So first of all, would you like to come up and show us your research?
Thank you. Super. Okay. Oh, thank you, Charlotte. Thanks, everybody, for being here. I'm really pleased to open the session this morning with the findings from some research by myself and my colleague, Dr. Catherine Lauber at the University of Edinburgh. And this research draws on a survey of civil society organisations and their experience of engaging in stakeholder consultation processes within EU health policy. So the research focuses at the European Commission level, at the work that the Commission does with stakeholder engagement. But as we'll see, many of the instruments are common to those that are used across other levels of governance, so the findings should be relevant across different settings. The survey was completed by around 30 civil society organisations a little earlier this year. I have just 5 minutes this morning, so I'm going to present the three sort of key takeaway findings for now, and then a report will follow later on with some more detail. So before I get started, just to give an initial overview of the types of consultation that the survey addresses. So these are the main consultation instruments that are used by the European Commission when it's engaging with stakeholders. Many of you will have been involved in some of them, have participated in some of these processes. What's mostly of interest to us is the extent to which these instruments have different degrees of openness, so whether a participant has to be invited to engage with them or not, but also the different formats of these instruments, the different timing of these instruments, the different kinds of information that these instruments try to gather from stakeholder groups. And so we're interested primarily in the extent to which different instruments might promote different levels of participation, so when civil society organisations are more or less likely to engage, and what that experience of engagement might look like once they decide to participate. So that's what the survey was trying to explore. So the first slide is just a basic graphic with the very first finding of how and when civil society participates. And what it shows is that civil society organisations are much more likely to participate in the forms of consultation that are more open. So the OPC, the open public consultation that runs online as a survey questionnaire, but also the feedback mechanisms where we can comment on pieces of legislation that have been published or on early edition roadmaps at earlier points in the process. What it also shows is that we were able to ask, and the reason that we asked why, when organisations don't participate, so we didn't just ask which forms of engagement they do use, we also asked which they don't participate in, and we did this because it enabled us to follow up and ask why that might be. And those findings indicate that for the more open methods of consultation, that reasoning is usually about expertise or technicality. So if an organisation feels that it has the expertise to offer something in the open consultation, then it will do so. If it feels that the issue is too technical or it's not within the organisation's mandate or the membership can't contribute the appropriate expertise, then it's less likely to engage. By contrast with the more closed forms of consultation, so ones where sort of meetings or focus groups or interviews, the reason that's usually given for non-participation is that organisations weren't invited, which I think says something about the way in which we need to structure the outreach and the engagement with those forms of consultation. So the second key finding that I wanted to present this morning is about the most meaningful forms of participation. So which of these consultation instruments do civil society organisations find to produce or perceive to produce the most meaningful engagement? And here there are two key takeaways that I wanted to mention. The first is that open public consultation is valued by pretty much all of the respondents to the consultation. Civil society really values the OPC as a process, but there is a concern about that becoming a box-ticking exercise. And much of that is linked to the extent to which the format of the consultation allows for open methods of input, so unstructured, free text responses, rather than closed methods of input where you can answer yes or no, or you can rank 1 to 5 about what is the most important issue or something like this. So the concern about box ticking, I think it's interesting. It's less about these instruments not being taken account of, and it's more about the format in which the input is able to be provided here. The second takeaway to raise at this point, I think, is that the bilateral and the small group meetings are the ones that are perceived to produce the most meaningful engagement. And that's logical, I think. But it's important because it's also the method that's least commonly used by civil society. And we might want to reflect on that a little. I would add that the survey was of civil society organisations. We didn't survey other stakeholders, and that's obviously work that we can go on to do. But the civil society respondents do sense here an imbalance in that economic actors are perhaps more likely to use the closed, invited forms of participation than civil society actors are. So that's obviously something that we would want to follow up. Finally, the survey asked for key asks from civil society, and I just wanted to mention 3 of those here. So the first one is perhaps quite obvious, but there's a need to, or an ask to, a request to better understand how input is used. Now, I should say there are provisions for this. The Commission does summarise all of the responses it receives to the consultation. It tries to give some indication of how those responses have impacted the final piece of legislation, but the suggestion from the research is that these provisions aren't sufficient in this way, and that's key because it's linked to trust in the process. If people can't see how what they've inputted has been used, then trust in the way that process works is going to be lower. The second one is about formats. We've heard this a lot, but the length of the questionnaire, the use of technical language, how accessible consultation questionnaires are is important, and also timing, not arranging questionnaires over holidays, having a sufficient duration of consultation instruments being open and available. These things are all important. we read about them in the research 15, 20 years ago. The fact that we're still hearing about them now is perhaps something we should reflect upon a little. And finally, civil society organisations ask for a better balance between open and closed input, so a better balance between these questions that allow them to impart more detailed and more nuanced information as opposed to ticking yes or no or ranking 1 to 5. And that's really important, I think, in terms of the online questionnaire where you can see how the more closed format might be easier to process or it might be easier to organise, but getting that balance between allowing for more detailed information is perhaps important. So I would just close by saying that there is a consensus that underpins all of the results and all of the responses that were sent to the survey, which is that capacity and resource is really important. And it's important from a civil society perspective, which we hear a lot, and we heard a lot in the session yesterday about having capacity to engage, but it's also important on the policymaker side, that the policymakers have the capacity to respond, to process, to deal with the inputs that they receive. And there I think there's probably some shared common ground for us to create a stronger system across the board. Thank you.
Thank you, Eleanor. And so your research is available if you want to read that again and try to learn everything about what you said. So we want something meaningful, we want something impactful, and we want means to be able to do that. But Stéphane, how is it on the side of the Commission, and how do you deal with our input as civil society?
Yes. Yes, it works. So thank you very much indeed. Well, first of all, let me say that the input of civil society is actually very important. That's a key element of policy making these days, and I will try now briefly to explain why. Well, first of all, we always want to do evidence-based policies. That's very important. But the sort of scientific evidence we often have does often not really include the subjective perspective of those who are affected by policies. And that's a very important ingredient that is also on everybody's mind. For example, the OECD is working on patient-reported outcomes. And the perspective of those who are, if you so wish, the target group of policies is very often not expressed in the clinical endpoints and biomarkers that we have in research, but it's still very important to have that because it can be a totally different perspective. And civil society is actually the most effective way of bringing this perspective of the target group to us. That's one important element. Another important element is providing knowledge. Because what we learned is that civil society organizations very often have a very detailed knowledge of the policy field we are trying to address, and it simply helps to know more about it from more perspectives. And that improves actually the quality of whatever kind of initiative or legislation comes out. That's also very important. One element which is also important is that these days there are often very many actors interested in the same field but from different perspectives. And very often our initiatives have either to prioritize or to do some sort of arbitrage between competing objectives which are represented by different organizations. And it is much better if, let's say, this arbitrage is then done in dialogue among the different civil society organizations than some commission officials sitting in their offices and trying to find the best kind of solution that suits everybody. I'm totally aware that this is a challenge very often for NGOs and civil society to do this, but we have a framework now in the health policy platform to do that. I will come to that in a minute. Yeah, I don't know how many minutes I still have left. Yes, I found it also interesting, the comments, the asks of civil society, and I'll think about that, the ones which Elena has presented here. But in any case, we have our main format for interaction with civil society now in the health policy platform. And that health policy platform was created in 2016. It's our IT tool for interaction with civil society and all stakeholders which we have. For those who are interested, there's actually a leaflet I can give you where you can download it. It gives you some of the key facts. It developed much more than we thought in 2016 it would. We have now something like 6,800 members of the health policy platform. That is quite impressive. We are now doing also, actually since 2017, the participants of civil society platform can also do webinars, and the Commission does webinars on them. We had more than 300 with more than 70,000 participants, so it's all quite impressive. And one of the functions I would really like to underline is the thematic groups, as we call them, where on a specific subject, all interested stakeholders who are member of the group work together to adopt a joint statement in a policy field which is interesting for the Commission. And we find this a very useful activity. In the years, we had already something like 25 of those joint statements, and they actually have better quality for us than input of individual organizations, 50-fold or something like that, but also more impact, because then we have more confidence that the result really represents the views of a large part of civil society interested in the subject. And that is very helpful for us. Before I forget it, on the 26th of November this year, we have the annual meeting of the Health Policy Platform, where the latest joint statements are going to be presented. And you are all invited, insofar you are a member of the Health Policy Platform. Actually, it would be interesting to see how many of you are members of the Health Policy Platform. Could everybody who is member of the Health Policy Platform, yes, just raise your hands? Yeah, so you are knowing what I'm talking about. That's interesting. Thank you. Thank you. Yes, and I also should not forget to tell you what policy statements are in the making at the moment. That is, the first one is a global continuum for healthy generations. That's led by 6 universities from 5 EU member states. The second is advancing precision medicine for Europe's cancer patients with AI-powered imaging. That's led by the European Society of Radiology. Then we have natural language processing for cancer genomics. That's led by the Robert Koch Institute in Berlin. And finally, towards an EU coordination plan for the brain, led by the European Brain Council. Yes, so those of you who are interested, please join us for our annual meeting on the 26th of November. I think that's it for the moment. Thank you very much.
Perfect timing. Thank you, Stefan. And where can we find this fact sheet for the people online?
I would say the easiest is if you Google Health Policy Platform of the European Union, then you get on the main page. However, those of you who have joined know this already. You need a so-called EU login, so an account at the overall EU system, and then you can enter the Health Policy Platform.
Thank you. That's where the finding, for those who were not in the participation session yesterday, see it online. Was really interesting to see the finding, especially on Austria, on the working with civil society, actually with the citizen and the patient, and what works, what doesn't work, and clarity and good access to the resources are essential. And when it comes to engaging patients and to gathering input of all different topics and interests and having a shared voice, Anka, I think you have many things to tell us about that.
Yeah, good morning. It's interesting that we have to repeat why including patients in policy is important. We've been doing it for some time, and I mean, clearly we have to be a little bit louder about it. The patient organizations exist to fill a need of specific communities to be cared for, to be supported, to be represented, to be served by their policies and by their institutions in their countries and at European level. And the European Patients Forum was created to bring a shared platform for patients' organizations from all over Europe and from all walks of life and from all disease areas to advocate on behalf of patients on all of those things that are important to all patients. Our motto, and this is where I have to start from, is nothing for patients without patients, and it's quite an obvious thing to think about. But one of the things that Ellie was mentioning happens a lot, and we are a little bit experts in dealing with tokenism and box ticking. Because there is still in policy making and in stakeholder engagement, there is still this, oh, where's the patient? Let's find a patient to tell us how it is. And it doesn't quite work like that in reality. Patients have the important perspective of the lived experience of a condition. Now, we represent people with chronic conditions, but it fundamentally doesn't really make a difference what sort of patient. There is that lived experience that patient organizations are able to aggregate into a voice for their communities. And that shared expertise, I mean, patients are experts in their own condition and in their own life and in their own experiencing of that. That expertise is unique. Now, I just want to be clear, we're not the only ones. We patients are not the only ones, the only voices who matter around the table. But it's very important that when they're at the table, that their voice matters. And that brings me again to something that Ellie was saying. In addition to box ticking, the feedback to patient feedback is also important. The responsibility to respond to that feedback falls on the policymakers listening to us. Tell us, did it make sense? Is it possible? Is it not possible? Is it going to work? Is it not going to work? So from my point of view, or from EPF's point of view, we have embarked in an internal consultation with our members. We came up last year with a manifesto for patient organization involvement in health policy at systems level. And to do that, we've done a lot of internal consultation, rounds of reviews, and so on. And we came up with these principles that say this is a two-way street. Policymakers have the responsibility to seek out, to involve, to include, to listen, to give feedback to patient organizations. But in exchange, patient organizations have the responsibility to build their capacity, to build their professional feedback, and to have a credible, strong, and democratic governance in order to be able to represent their communities. It's really a two-way street. So in order to avoid ticking boxes, we have to make sure that as a community we're bigger than a simple box to tick.
Thank you very much, Anka, and we really relate to that. At UFA, with scientific organization, we also need, I think it's even a three-way path, we also need to really involve patients in research, and not only as acknowledgement at the end of the research, but as co-author. And this is also, the much we empower our voices, the more we amplify our voices, the clearer we can be audible to the policymaker. Yet, there is love. Civil society, you say, is really important, our voice are important, and they're proof of love. So finance is always one of the elephants in the room. And how do we ensure sustainable funding so we can actually train ourselves, build capacity, and provide good answers to the Commission? Ray, would you like to elaborate?
Yes, thank you. Thank you, Charlotte. So when I was reflecting on what I wanted to convey today, different messages came to mind, such as stressing the importance of the role of civil society in democracy, in developing equitable policies. Charlotte, you just mentioned to the session of yesterday on the commercial determinants of health. I think it was a great session. If you have not seen it, I really do recommend that you do. I think there the role of civil society, the important role, really came to the fore. Also in the context of this power imbalance that is there. You know, you mentioned the Goliath, who has some tens of millions for lobby versus a tiny fraction of that for David's advocacy. And I will let you guess who is the who in that. But also the message of the importance of sustainable funding and also clear perspectives for civil society on financial support for our working. But the key message that I wanted to stress today, and I formulated this before yesterday's plenary session, because there I think that was also one of the key messages that at least I took from it, is trust. And I think we need to work on strengthening mutual trust. And I'm saying mutual because it needs to come from both sides, of course. And I think to do that, we need to talk to one another more, like we do here, perhaps with a little bit less alcohol, but also how we have done in the run-up to this session. Because sometimes I think we forget that besides stakeholders, policymakers, NGOs, academia, we're also people. And I think we need to connect on that level as well. So to make that a little bit less fluffy, I want to give you 2 quick examples, 2 personal experiences that I had with some of the formats of engaging with the policy process. And the first one is the midterm evaluation of the EU for Health program. I will not go into detail about the character space, the timing over Christmas, or the lack of progress data. But basically, the Commission spent some billions of euros on health and asked, how do you think that we did? Without providing any data on the impact indicators. And I think we had a conversation about it yesterday. I don't think the impact indicators have actually ever been quantified. Since we spoke about reform as well, I think it was on Tuesday that Nick Fahey mentioned, and of course it was the reform, it was about health systems, but he was speaking about maximizing efficiency. And I think if we have 5.3 billion, or minus 20% of that, I think it's a legitimate question to ask ourselves, how are we actually spending this amount of money? Another small example is the EU Beating Cancer Plan and how the working groups are operationalized. I have attended a couple of the stakeholder groups on specifically the Cancer Inequalities Registry. And for those of you who have been engaged in this process, I suppose they use it for the other working groups as well. The Commission uses WebEx. And you're basically in a system, and I think they use the webinar setting, so you have no clue who is actually in the meeting. There is, encouragement from the moderators to drop in the introduction who you are, but it's a big barrier to, to speak into a void and have no idea who is actually around the table. So these are 2 small examples that, it didn't increase my, let's say, trust in the system. But I think these can also be addressed. To give you 3 quick points. I think resources. Resources on both sides. Yes, we want to have financial security. I will finish quickly. Yeah. But I think also the resources for the Commission, because there has been a drastic reduction in administration costs on the Commission side as well. So if there is 5.3 billion, this also needs to be matched with sufficient resources to actually manage this. Capacity building on both sides. We need to learn how to speak with policymakers and vice versa. And the language is important, was also mentioned yesterday. And working together. So when we speak about impact indicators, let's work together. When we speak about the health policy platform, well, I can tell you that the civil society has a number of ideas to make this even better. I'll stop here.
Thank you very much. Thank you very much. And now we'd like to engage with you. Paola, you're Orion Gesteiner, and you're also moderating. I don't know if there are things online, but we'll put the Slido if you want to take off. And we have 2 questions for you. The first one is, what is the most important thing that civil society has to offer when addressing the current challenges that face our health system? And public health system, I will add, because sometimes we stick to healthcare and not in everything before. And the second question, I'd like to challenge you a little bit on that, is how can civil society change the way in which it works to strengthen its voice and participation? There are 2 things here. We need to build trust. We need to be trustful. We need to be serious. Does it mean we cannot be radical? I don't have the answer. What I know, and we talked about it, is when the agricultures are sending tractors, not all the agriculture actually, some syndicates and power organizations send tractors into Brussels, they change laws in a much more efficient way than we do. What are the public health tractors? How do we deal? We've seen, maybe some of you are even member if you want to talk about it, scientific rebellion. Climate scientists say we cannot stay mute anymore. We are not neutral. We need to take a step. We need to do something. We need to have rebellion because it's the whole life of the planet that is in danger. So yes, we have to build trust. Maybe we have to be more radical, but we need to be radical while keeping dialogue. I don't know that. I would love to hear from you, and I don't know if we already have some things.
Yeah, we have some questions from the online audience, mostly actually regarding previous discussion, if I can bring them back again on the funding and resources issue. And they were also asking about it in relation to the formats of engaging with civil society. Are these funding issues also influencing the ways we can engage with civil society? And then also another question was more about how can we make sure there tends to be sometimes a gap between the European level and people's lives. So how can we make sure that people actually understand also on their side the importance and the impact that the European level has on their day-to-day life? Thank you.
Stéphane, maybe someone else, you want to answer that? And then we'll take questions from the floor.
Yes, I'm not sure that I got the questions completely. On the link between what is happening at European level and what kind of impact does this have on the life of people on the ground, to put it like that, that's of course a very important question. And it's a complicated question because of the legal situation in the area of public health, for example. Basically, it's the responsibility of member states to provide a health system for their citizens and to protect their health. And the role of the EU level is actually to complement what member states are doing with what we call European added value. So we are complementing what member states are doing, and it is always very difficult to point out in detail how exactly this will change the life of citizens. Yes, this is a challenge. We hope that our strong cooperation in the health policy platform can actually improve that situation. If, let's say, our main interlocutors, which are usually organizations which are Brussels-based, have strong connections to national and regional organizations, this can improve things. Recently, we did also things which are closer connected during the pandemic, for example, when the Commission bought the vaccines for all Europeans, essentially. There everybody could see what direct impact it had on their lives. So there are also examples which can show this. I can also tell you that we in the health department, try to learn from other departments of the Commission which have a closer connection directly with citizens. For example, DG Regio developed a system of communities of practice, which is operational in the regions of the European Union to work on the policy aims which exist at European level. And we are currently seeing in the area of long COVID whether we can make use of those principles to let those people in the member states who are directly in contact with long COVID patients benefit from cooperation with other such people in other member states, for example. But in the end, I come back to the fact that in the area of public health, where we have no legislative competence, we depend on cooperation with the member states. So we only interact indirectly with citizens. That cannot be denied. But what we do is we try to improve our cooperation with member states, which in the past was maybe done mainly through formal interactions in council, if there was a new program proposal, something like that. We have now the so-called Public Health Expert Group, which meets regularly, which discusses all areas of health and allows us to understand quite clearly and every 3 months or so from the member states what their concerns are. And then we can find out what could be EU added value, how we could help them. So we try to better help citizens by better helping their governments to help them, if that makes sense.
Thank you, Stefan. And yesterday we also talked a lot about how it's a cultural battle, and it's hard for us to tell the story of what we do. It's really technocratic sometimes. We have lots of platforms, lots of very important work. I was talking about, I don't know if some of you see the TV show Parliament, which is French and German and talks about the European Parliament. It's really funny. It's really sad too, but it also explains how things are going with very lively people. And I think some of this, if we want to actually tell the people what's happening in Brussels, we also need to have better storytelling, understandable about what we do and what we actually achieve. And Kai, you wanted to say something, and after we go to...
Yeah, I started with one thought, then I had two, and then I had three, but I'll be very quick. The first thing, my experience when I started in the working in service of the patient community is that our narrative is not about battle, actually. It's about cooperation and about constructive dialogue. So we also have different cultural narratives within civil society. And I don't necessarily think that my community, my membership, has any particular appetite to go into a radical direction. Maybe we should, I don't know, but I don't necessarily see it happening because we have a culture of being sort of polite and constructive. But anyway, my first thought was when I heard about, funding and resources is it's also a question of the value of values, if that makes any sense. If we agree that civil society involvement is important, then we also have to put the value to it. That kind of makes me think of what Stefan was saying about, consultations and involving patients. And, we spend a certain amount of FTE responding to consultations. In order to be representative of our community and to consult our 80 members, and some organizations have more than 80 members to consult, that requires them time, that requires them energy and knowledge. Now, Ray was mentioning Christmas very politely in passing, August, Christmas holidays, and so on. It takes a little bit of time for organizations that try to actively elicit input from their members to collect that input, digest it, turn it into a common position, and then present it. Sometimes the timeline we are confronted with are just not enough. And I understand that, policy has to happen a little bit faster because we live in a very fast-changing world. But sometimes you just have to give it a little bit more time.
Thank you very much. And that's also how do we ensure the quality and the real representation of what we promote if we don't have the time?
Democracy, yeah. I mean, the representation. If I want to be representative and credible, then that is how I have to do it, and it is what it is.
Totally. Do we have questions in the floor? There. Oh, we have someone.
Hello, good morning. Here is Diogo from the European Doctors. I fully agree with the statement about the Christmas and the summer, because in my experience at work, one time I reached out. I wouldn't say which was the European doctor, the European actor, but actually I was like, okay, but why you gave just 2 weeks of to provide input? Well, we prefer to do like this, and we see after if we receive. But we need to plan. If you give 1 month, for example, is better than just 2 weeks, so organizations can better plan and collect the input in the organization. And also another question is for the Commission. Actually, you receive a lot of input from different stakeholders, but how you process this input, how you calibrate which ones you are taking on board? Because let's be realistic. You cannot just process everything and put everything together, but how you process this in a coherent manner to inform the design of policies. Just that. Thank you so much.
Thank you. Stefan, you want to take that? And then...
Yes, that depends on, this processing depends on what we are talking about. There are formal ways of processing. For example, if you have public open consultation, there's a formal way of processing this. And there's feedback from the Commission why certain things have been taken into account and others not. If this is a more informal sort of consultation, then of course the processing is also more informal. But one thing I think I should really stress here is that when you interact with us in the health policy platform or in what Eleanor called these smaller meetings, let's say, then you are talking directly to those people who are developing policy, to those colleagues who are in charge of actually doing the drafting. And so the processing, if you call it like that, is really a very personal affair. Yeah, it's among those colleagues drafting and in the interaction with the policymakers, with the commissioner. So that's the way that this is processed. And when you say processing, I would also translate this into, let's say, turning all the different opinions on a specific subject into one policy line, to put it like that. And that is where our thematic groups in the health policy platform help, because actually the processing, if you so wish, is done among the civil society organizations participating in the process. And what we receive is the final result. And as far as I'm concerned, that this is really a key element to have a balanced perspective. One thing I should also say, of course, is the policy process is what it is. And all those who have experience with that know that it is a process which is, the end result is determined by many elements, formal and informal. There's also a very important element of timing in this. And there's always a certain measure of unpredictability. So I think what we will never achieve is a situation where you have the end result, say a draft piece of initiative, and for each of the lines you have an explanation. This is because X said Y in meeting Z, something like that we will never have. But I do think that there are some examples of initiatives like the Mental Health Initiative or the Europe's Beating Cancer Plan, where you can really, if you read the text, you can recognize where it comes from. I think that was a very productive collaboration. Yeah, so I think in the end, we are making progress there.
Thank you. Ellie?
Thank you. I wanted just to add on to what Stefan was saying, because the processing question, it's logical that we would direct that to the Commission, but in many ways we needed a sixth person on the stage from one of the consultancies that is increasingly running these consultations, right? And this links back to the capacity question. If we don't give policymakers, whether it's the Commission or at some other level of governance, the capacity to run these consultations, then the amount of the interaction that is in that personal nature that Stefan's describing is always going to be very small. The agenda we have right now means that we run consultations and impact assessments for everything, and that's fine, and there are benefits to that, but it also means that an increasing amount of it is outsourced to organisations that are not represented here, that do follow the same guidelines, but to which we have much less access and oversight. And it's a practical problem. If Stefan and I were discussing yesterday, if there are 1 million submissions to the consultation, there is just no practical way for those all to be processed directly. We're going to have to use AI or some other technology to help with that, and we know that methodologically that has challenges for what we then extract from the data, and it's not ideal. So just to throw out that processing question is linked very closely to the capacity and the resources question on a policymaker side.
Thank you. We'll take 3 questions. Oh, you want to add something? Yes?
I do have one excellent practice coming from the Commission recently, actually. There's an ongoing stakeholder consultation on a policy file, and we were asked early in the summer for it. And we said, we need a little bit of time to collect feedback from our members. We're running a survey. We had time to do it. And then we will have that interview and that consultation once we have the results from our survey of our members. And giving us that amount of time, it allows us to collect something like 70 answers to a survey and give a real community view. And there's a lot of value in these stakeholder consultations, if done also in a sort of accountable and transparent manner, of course. But there is value in that, because you can really go into depth and be very thoughtful in how you input.
Thank you. And also sometimes health is about all the other policies. And this is something also we need to address. How do we answer to non-health consultation that actually affect health? So we have Frick, Martin. I'm sorry, I don't know your name. And I don't know your name either. Go ahead.
Hello. Yep.
Yes.
Okay. I'm Freek Spinnewijn. I'm director of FEANSA, which is a atypical participant here in the conference, I think. We work on the issue of homelessness as an NGO. My first point that I want to make is that if we want to have the involvement of civil society, we have to break out of the sort of closed circle of civil society in the health space, in the proper health space. My organization is not part of that. We're outside of that, but we can be a major player. So let's be a little bit creative. Huh? It's not only about patient groups, very important, it's also about other organizations. And a comment to the colleague from the European Commission. Like, I don't think civil society is only a source of opinions, providers of subjective perspectives of the people on the ground, etc. We're also potentially partners to deliver policy impact on the ground. And that I hear too little. Maybe the session is not about that, but just to give an example about my own organization, we represent probably close to 1 million beds in shelter, in homeless shelter, 1 million in the whole European Union area. Most of the people in the homeless shelters are sick. We could be used to reach out to this target group. We could be a key partner of the European Commission. I have knocked many times on the door of DG Sante, but I don't get like the response back. And very quick question to Ray. IFA is supposed to be a major player in the public health space. Can you just tell me what IFA could do better to be the genuine voice of civil society and European citizens on health and public health?
Martin, we'll take the 4 questions and then we'll round to answer.
So we all agree that it's important.
Can you, I mean, I think most of
Martin
would be,
McKay,
yes, thank you.
European Observatory, London School of Hygiene. Yeah, so we all agree that getting grassroots views is important, but some of those grassroots are actually astroturf, and some of the apparently civil society organisations are not who they seem to be. Now, there are ways of sorting that out, and in particular using tools like quantitative text analysis, which we've done, in fact, with one of my students who is currently a commission employee, looking at the acrylamide consultation, where you can actually differentiate the texts according to where they come from. My colleague Mark Pettigrew, who may or may not be here, is using other forms of AI to do that. And then really digging in to find out, understand the motivations of what is being submitted to you. So I'm just wondering, are you considering making more use of these techniques to get a more nuanced understanding of what you're getting in your consultations?
Thank you, Martin. No, yeah. Here and here, yeah. She was before.
Thank you. My name is Vesna Petric. I'll start with, just recently now has been adopted resolution on social participation. What does it mean? It's WHO, it's countries, so they have decided that this is seriously important. Do they only mean that they want to hear better the voices of civil society? I doubt. I don't think this was the meaning of the resolution, because the tasks for the WHO there are saying that they should support countries to institutionalize social participation. And this doesn't mean only participation in meetings and having a voice and participating in decision making. This means actually working together, because there's such a strong potential in civil society. They can do the work, and I couldn't agree more with the colleague that was speaking before me that is looking at his mobile at the moment. Forgive me, I forgot your name already, but I couldn't agree more. There's so much to be done, and civil society organizations are far from just being people getting together and complaining about everything. They possess knowledge. And trust, by the way, do you really believe that trust can be built only by getting together? Isn't it that the trust really is built when we have to do some work together? Then we challenge each other. Then we see if we can trust each other, because, working together sometimes is really hard. So how does you, civil society representatives and the Commission, see, for example, having a strategy on health literacy in the state or at the Commission, and having NGOs as partners for implementation, because they are the ones who can only reach, it's not health professionals, the most vulnerable, the hidden populations. How are we going to reach them? We don't know, and we don't care most of the time. But that is the point, to reach the most vulnerable. Okay, I'm
Thank you
will be
very
glad
much.
to hear.
Good morning, everybody. My name is Inna, and I represent patients of Ukraine. It's a patient-based organization. And I have a question to Anka, my European colleague. Anka, please give some practical examples when the voice of patients was heard and was taken into consideration while designing policy changes in healthcare.
Yakuyu. Do we have anything you'd like to share of what is online?
There was actually a comment, I don't know if it was from the online audience or the audience here, but just to reinforce on Anka's point about feedback to feedback, so getting back to patients, and there was a comment just saying that actually this is a thing that is shared in the room, and the fact that when they don't receive an answer, they have the feeling that they are not heard, so how can we change this in practice? Like, what could be done in practice to change this? Thank you.
Thank you very much. So I propose we do a last round because time is running, and then we'll be here to discuss things if we want to. I also would like all of you, when you do your last thing, what should be, and we heard we are not one civil society, we are several civil society, but what could be our shared priority, and exactly what you said. How can we actually really achieve our mission, and how can we do it? What would be the next step, and what do we want to speak about next year when we meet again here? Ray?
Yes, thank you. And thank you, Freek, for the question. I think it's an excellent question, and also thank you for recognizing IFA as a key player. I think the first thing what we can do better is to always think, what can we do better? You know, we are a very young team. We just had our first European elections. Many of us was for the first time that we went through this process. So I think, you know, we need to always keep developing ourselves as an organization. Another thing is to go out more. I think we're still quite in a COVID mode. We work a lot from home. We work a lot digitally. And I think we need to go out more and engage with policymakers. Another thing, we are an alliance. We spoke about resources, but one of the things that we can do better as an alliance, to be totally honest, is work better with our members. This is also, you know, a resources thing, but this is something that we as a public health alliance can really strengthen. Vesna, trust. I fully agree. I mean, that's also what I just mentioned. One of the things is that we do need to work together, whether it is, you know, strengthening the health policy platform, indicators to measure how we work. So yeah, I could not agree more. To the point that you were just mentioning about the being heard. Yes, I think, you know, about this establishing relationships and establishing trust. We were speaking about it yesterday when we were preparing for the session. An important element is actually listen and to get listened to. And if you want to have the buy-in from people who do not necessarily agree, at least when they have the feeling that they are listened to and whatever they say, you know, is being taken on board. Well, maybe it's not going to be, you know, integrated in whatever initiative, but at least they have the feeling that they have, you know, have been listened to, have been looked into the eye. I will stop here. Thank you.
Sure, thank you. I'll just pick up on a couple of points. So to Vesna's point about the wider participation, that's definitely true. So consultation is one part, clearly, of civil society's involvement in the policy process, but also in society at large. I guess our interest in the specific piece of research is, well, consultation is a tool over which we have much more control, and yet there seems to be very little discussion about how the best way to design it is. I was quite surprised to find so little in the literature about how well a consultation can be designed, what's good and bad about a consultation, how we can do it better. There's very little information about that, and I found that quite surprising. It seems like an area where there's space for work and it shouldn't be so difficult to achieve also. So I was heartened, I think, by the responses we had to the survey that said, yes, we know very clearly what the problems of this process are. We're all here to work together to try and fix them. So I'm excited to take that work forward and to put together the recommendations that we'll put together over the coming months. Freek's point also reminded me, yes, indeed, NGOs outside of the health sector, but also it reminded me that the health NGOs face perhaps a slightly different problem to their colleagues in other sectors. So I doubt very much that the transport NGOs, for instance, spend a lot of time looking at consultations for other policy areas, whereas the health NGOs are having to cover pretty much every sectoral portfolio of the Commission, right, in order to be able to do their jobs properly. And this just all boils back to the resources point. If we don't have the manpower to do that, if there isn't sufficient capacity, then it's just going to be impossible to truly honour a health in all policies approach, right, and to be involved in all the areas where they need to be involved. So that strikes me as another area when Charlotte talks about what we can do better and what we can be doing and talking about next year is, well, how are we working together to solve that problem a little bit?
Stefan?
Yes, indeed. Maybe also commenting on this. Of course, we would love to have other NGOs from other areas also in, say, the health policy platform. Yeah, indeed, they seem to have a capacity problem there, or they are just not interested. But it would be super useful also because we are now having cross-cutting policy initiatives like Farm to Fork or Green Deal, which would benefit a lot from some coordinated input from NGOs from other sectors. So we can agree that this would be good to have, but how to achieve it, that's still an open question. But it's a very good question. And then let me say a couple of things about NGOs as partners. There we might not have the ideal framework. We can finance NGOs from EU for Health. We have actually made a special effort. I mean, you will know there's the operating grants, which are to support the day-to-day running of organizations. We have also in those areas where traditionally only member state-owned public institutions and authorities can participate, the so-called joint actions. What we do these days is, in addition to the call for a joint action, which is only for authorities and governments, we publish another call for action grants, which is specifically for NGOs in the same area to allow the NGOs to actually cooperate as partners with the authorities of member states. Yeah, this is maybe not the ideal solution, but this is the only thing which is possible under the current financial regulation. And to be honest, there's not much hope that this will change for some fundamental reasons I can explain bilaterally. It would be good to have the NGOs as partners, but we are still lacking the ideal framework. We could try to work on that in the coming years and decades, I think. Yeah, I've also found Martin's question on whether we do analysis of the motivation behind submissions in public consultation very interesting. We do have artificial intelligence, if you have many submissions, to have an idea what those submissions say. But I do think trying to analyze where they come from and then somehow grade them according to the sender, yeah, or those who inspire the senders, could be interesting. But I think there's also a problem, because who are we as Commission to make judgments about the motivation behind submissions? We are supposed to treat, and I think it's even in the staff regulations, we are supposed to treat everybody's views equally. So in a way, we are obliged to take them at face value, if you so wish. But that's a very interesting point. Except, of course, the tobacco industry, because we are partner to the Framework Convention on tobacco. But it's a very interesting thought. What else? Yes, and generally speaking, I would also say that health policy could benefit a lot from better cooperation between all the actors, civil society and governments and Commission and WHO, and in some areas also OECD. And I do that every day in the areas I'm responsible for. But this is also a real challenge, because the more organizations you have around the table, you have to respect all their decision-making procedures. If there are financial flows involved, they have all different financial regulations. So the more you have around the table, the higher the percentage of the resources is that goes into pure administration and coordination. Not speaking about potential political processes anyway, but I completely agree with your objective. We could achieve much more if we would do that more often. I think I'll leave it here.
Anke?
We're running out of time, so I will stick to the one question that the colleague from Ukraine asked, and we should talk afterwards, because last night I promised to find you and work with you. So, so it's wonderful that you found me. You asked me for concrete examples of advocacy successes. I'll give you two. One is in advocacy for patient representation, and that is, I would give as a wonderful case study the participation of patients in the processes in the European Medicines Agency at all the levels of the agency, including with a definition, with criteria, and with allocated spaces that have equal decision-making power within the agency's processes. And at the moment, at EU institutions level, is probably the best practice in patient involvement. Now, in policy advocacy, I'm not going to make a lot of friends with this example, including in our commission, but never mind. In the European health data space, when there was a major debate about the use of patient data for research, so secondary use, anonymized data, and so on. There were two debating camps. One of them advocated for an opt-in where patients actively accept to give their data they have to sign, like a consent. And one that said, no, there's nothing needed, all this data should circulate freely because researchers need it and innovators need it and so on. What our community told us, and it's both a consultation democracy and advocacy success, what our community told us was, we want to share our data. Patients, our members, they want to share their data for research purposes to improve their conditions and others' conditions like them. However, they need some reassurances that they can opt out if they find themselves as individuals in a situation where they don't want to share that, especially in communities where there's stigma associated or financial penalties or things like that. And so we ended up being somewhere in the middle, but with a very, very strong mandate from our membership. And we were able to put that on the agenda and ended up kind of the only stakeholders that defended the idea of an opt-out, where patients by default share their data, and their data goes into the big pool for research, which is really important, but some patients can opt out. So I'll stick with that, but let me just once say, big thank you to Vesna and to Slovenia for having championed the resolution on civil social participation. We've been asking for it. We've been asking for institutionalized patient participation because we're a patient organization, but you've gone a step further and you're providing the basis for our work moving forward. So thank you very much for answering that need.
Thank you very much, Lanka. What I get from here to really wrap up quickly is that we need to build more bridges. We have ecosystems in Brussels. We need to build trust and go on and continue to speak and report. I think we should build bridges in the countries. In every country, we have the National Public Health Association, you have NGOs, you have patient organization, you HealthNet, you have institution. If the ecosystem we have and building in Brussels could be repeated in the country, it would be a way to amplify this participation, to amplify the voice, to amplify the feelings that we need to do something and link to other policy and like for instance the most vulnerable through shelters and with homelessness, with all the marginalized community. We cannot do it from Brussels, but we can be more powerful in amplifying their voice if we have ecosystem on the countries. So I'm really happy that we can start the discussion and report on it on the next months. I think we can do it in EPH conference, in European Public Health Week, and see you next year. Thanks a lot to University of Edinburgh for this. I know the discussion and everything that was online will keep informing the report on civil society participation. Thank you to the European Forum of Gastein, and see you then. Bye.